We Together, a coronavirus discussion sponsored by Stormont Vail Health.
It's the beginning of a new chapter in the coronavirus crisis, as the first shipment of Pfizer's vaccine heads out to healthcare facilities across the country. Tonight in our coronavirus special, We Together, we're bringing in our experts to answer your questions about this vaccine. When will it arrive in our area? The current plan on who will get it first in the state, and how long do people need to wait in between each dose in order for the virus to be effective? We'll answer all of that tonight. And right now, the largest, most ambitious vaccination effort in U.S. history is underway. Thank you for joining us tonight for our special. I'm Brooke Lennington. Tonight, I'm joined by two leading doctors in our area, Dr. Clif Jones and Dr. Donepudi, who you see here with me now, both with Topeka Stormont Vail Hospital. And I want to thank you both for being here with us tonight and for helping us answer some of the burning questions so many of us have. And I know we only have about 25 minutes here tonight, so I don't want to waste any time. So the first question I have for both of you is if the Pfizer coronavirus vaccine has arrived at Stormont Vail, and if not, when do you expect to receive it?
Not yet, but we do expect to receive vaccine this week. So I know Wichita got some of theirs today and we're able to start some early vaccination efforts, but we do expect our supplies this week.
Okay, and do you guys expect to, you yourselves receive that vaccine this week, hopefully?
That's what we're waiting for, yes.
Okay, and is there a game plan currently underway right now at Stormont Vail for who will receive it? Will it be mainly the folks at the ICU and the emergency rooms treating the COVID patients and then kind of layered on up from there?
You got it exactly right, Brooke. KDHE's direction, based on the very limited supplies that we have in this first shipment, was to make sure to prioritize those folks who are in the COVID-facing units, so ICU or in the hospital especially. And the reason for that is twofold. Really, they're at the highest risk for exposure and for getting COVID-19. And the other reason is that we really want to preserve the community's capacity to be able to take care of the community. And the way to do that is for us to keep our healthcare workers healthy and at work.
And I know those healthcare workers like you yourselves are at that top of that list for the governor's plan. And I do want to touch on that right now before we dive into all of our viewer questions tonight. The current plan in Kansas on the order of who's getting the vaccine. Let's go over that. The state has lined out 5 phases, so let's break those down. The first phase will be frontline healthcare workers and long-term care residents. Frontline healthcare workers are classified as those that work with coronavirus patients in hospitals or at long-term care facilities. Now, phase 2 will be anyone the state deems as an essential worker. For example, first responders, meatpacking plant workers, and grocery store workers would fall under that category. And phase 3 and 4 will include anyone 65 and older, as well as those concerned with high risk or concerned that they have high risk for underlying health medical issues like diabetes and asthma, so they will fall under that category. Now, phase 5, they will be anyone not considered high risk under the age of 65. And before we dive into more of our questions tonight, I just want to go over how this will work. Upon reading the question, I'll ask both of you to respond, or one of you to respond, but then both of you, please know that you are more than welcome to hop in at any point. Okay, so let's dive into that first question now. So our first one comes from Linda, and she wants to know, if you have already had the virus, do you still need the vaccine? So Dr. Jones, we'll start with you on this one.
Right now, the answer is yes. The durability of immunity to the virus after a natural infection is not yet known. It's thought to be significant and protective, but again, the magnitude of that protection really isn't known. There are general recommendations that once an individual's recovered from COVID-19 infection and has resolved all infection symptoms, if they're in a category felt to be at higher risk or at a higher need for the vaccine, they should consider receiving the vaccine.
Okay, so anyone at home currently thinking, hey, you know what, I already have this, maybe they even noticed that they have the antibodies, definitely still need to receive this vaccine.
Yes, again, some people will, especially if they've recently had the infection, they may choose to defer. They still should get the vaccine, but they may choose to defer. Some recommendations would be 90 days, try to get in line to get the vaccine thereafter.
And that's good because that answers many, many questions that I know so many of you sent in about that. Now, we do know one thing about this vaccine is it requires 2 doses. So it's an important aspect to remember with all this. When we hear in Kansas, for example, that we received nearly 24,000 doses of the Pfizer vaccine, this first batch, really, that means only about 12,000 people in the state will be the first to receive this vaccine. but it's not a double dose people receive back to back, which brings us to our next viewer question from a different Linda. She wants to know how much time must elapse between doses, and if that time interval is not exactly met, will the vaccine still be effective? So Dr. Donepudi, can you weigh in on this one?
Sure. Brooke, first let me clarify. The 24,000 doses that the state will be receiving is for the first dose. So the federal government and the state government will be holding back that second dose. So it is actually 24,000 people that will be able to receive their first dose of the Pfizer vaccine and then be able to, in 21 days, receive the second dose of the Pfizer vaccine. We're still trying to get clear guidance regarding the safety margin or the safety window on the vaccine. The current guidance that we have is around a 4-day window. They're saying basically from day 17 to day 21. The phases, the studies, they did not exclude folks unless they were 42 days late for the second vaccine. So that's something that we'll probably understand better as we go on and have clearer guidance regarding what our error margin is for the second dose range, date range.
So I've heard anywhere from, I've even heard the number 3 weeks. Is that a number that you two have both heard as well as the typical range that they're aiming for?
21 days for the Pfizer vaccine. Moderna will be 28 when that is available. That's not available yet.
Correct. And as we know, they'll be meeting, the FDA that is, they'll be meeting this week on Thursday to hopefully decide whether or not that one will be approved. One thing I do want to ask both of you as well is, with this being a double dose, does it concern you that some people might say, hey, you know what, I've already had 1 dose. Do I really need the second dose? What do you want to say to people who might be thinking, I'm just going to get the 1 dose and call it good?
Get both doses. Very, very important to complete the course and ensure the maximum immune response. Again, especially right now when the allocations are limited and availability isn't universal. If you have the advantage of the opportunity to get the vaccine, not only get it, but get it right, get both doses.
And it's the effectiveness I know that we're looking at there as well with those double doses. I do want to get to our next question now. It comes from Michael. He sent in actually 2 good questions, so I'll start with his first one here. He asked, because people can be COVID asymptomatic, should we get tested before we get the injection? So Dr. Jones, let's go back to you on this one.
No, that's not necessary. Again, we already had discussed it's likely of additive value to get the vaccine even if you've had natural infection. Having asymptomatic infection, we really can make an assumption that some people will have immunity. We don't know to the extent and its durability. So by all means, people should get the vaccine. There's no indication or no need to be tested before the vaccine.
And Michael's second question is in regards to the allergic reactions. We've heard that some have experienced after receiving the Pfizer vaccine. Last week is when we first heard about this in the UK, when those folks there received it. And shortly after learning this, it was recommended that people highly allergic to vaccines or have had bad reactions in the past after receiving a shot should not get this vaccine. So Michael wants to know, what are the specific allergies that occurred and what was the duration? I know this might be kind of a more very specific one, so Dr. Donepudi, if you can just weigh in here on what your take is on this and what you've learned so far about these possible allergic reactions that some have had from this vaccine.
Sure. The concern that was raised in the UK really had to do with a reaction we call anaphylaxis, and that basically means a whole body allergic reaction, one that kind of makes your throat swell, you have trouble breathing, those kinds of things. So that's really kind of the most severe type of reaction on the spectrum, and that was what raised the concern in the UK. So someone who has a severe allergy, as you said, Brooke, to vaccines or the vaccine components especially, should probably hold off until we have some further information as more and more people are receiving it. There were 43,000 people in these phase trials, but as millions get it, we'll have more robust information available to us. But there were some concerns raised in the UK regarding if you have severe allergies in general, to the extent that you have to carry around an auto-injector or an EpiPen, that may also be a reason for precaution. That didn't make it into our guidance from our ACIP, the Academy of Immunization Practices, but that may just be something else to discuss with your physician or your provider before deciding to get the vaccine. Clif, anything you wanted to add on that one?
No.
And I do just want to follow up on one thing. You mentioned the EpiPen. So if someone is, maybe they typically do carry around an EpiPen for possible issues, do you suggest that when they go get the vaccine, maybe it's safe to just bring one with them just on the safe side?
Never a bad idea, at least for our vaccination efforts, and really for anyone who is planning on doing broad vaccination efforts. They should be prepared for to be able to administer epinephrine on site. So basically basic rescue procedures and services anywhere that they would be receiving the vaccine should be available.
All right, very well. Well, hey, we're going to take a quick 2-minute break. We've already gone 10 minutes now, so when we come back, we'll have more of your questions answered. Don't go anywhere.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
There are so many remarkable women who are leaders, teachers, mothers, and friends. Who are the remarkable women in your life? We want to share their stories. Nominate your remarkable woman today at KSNT.com.
Winter Wonderland is back with all of the dazzling lights you've come to love. And your drive through this 2-mile light display will help benefit TARC and the thousands of individuals with disabilities who rely on its services. Please support TARC and Winter Wonderland.
Welcome back, and thank you for joining us here tonight. I'm Brooke Lennington, evening anchor here at KSNT, and we are potentially at the beginning of the end with this coronavirus. The first COVID vaccine, the nation's best hope to stop the virus, is currently going out across the state tonight. And tonight I am joined by 2 top doctors here in Northeast Kansas, Dr. Clif Jones and Dr. Donepudi, that you both see here, both with Topeka Stormont Vail Hospital. And our goal tonight is to get as many of your questions about this vaccine answered. And we asked for you to submit questions, and we've received dozens in the last week from people like Regina. She says that she's over 65 years old, is a diabetic, and has asthma. So she asked if she has to have a script from her doctor and present this when she goes to one of the distribution points in order to get the vaccine. So Dr. Donepudi, I'm going to start with you on this one.
She will not need a script from her doctor. We won't have the vaccine available for her quite yet right now, and I think Brooke mentioned the total numbers for the state. We're really not able to even get past healthcare workers at this point and even get all of healthcare workers immunized. And the current projections are really looking like late spring before we'll be able to have enough vaccine to be able to get it out to the public. But she would definitely meet the criteria for being a great candidate for the vaccine and would not need a doctor's order to do so.
And you touched on the projections there, and I just want to go back to that. So let's just say the average Joe right now watching, maybe in their 30s, their 40s, not any underlying health issues. They may be wondering, hey, when am I realistically going to get the vaccine? What would you tell them at this point?
So it's a little bit of a guessing game right now, and it really depends on vaccine production rates and how quickly it gets deployed. But what you mentioned before in terms of the governor's phasing plan and KDHE's phasing plan, the high-risk folks with the chronic conditions would precede the folks who are less than 65 with no underlying medical conditions. So for them, we may be looking at early summer, potentially, before we have enough supply to really be able to get to the non-high-risk folks.
And I want to ask you both, as doctors and medical professionals who see patients on a regular basis, is this going to be a time where you may have to choose who receives the vaccine over one patient over another, and is that just going to be the ultimate most difficult decision you've probably ever had to make as a health professional?
I think there are well described guidelines out there for reading and calculating risk for patients. It's not an easy situation at all. The problem will solve itself when the production reaches the point that it's not allocated in small batches or medium-sized batches. Again, the hope would be that Dr. Donepudi's very realistic projection may be on the pessimistic side, but it's going to be months before we have enough to provide these patients that have risk factors and have an available vaccine for them as they come up. Again, I don't know. It's a difficult decision, but I don't know it's one that we're going to have to make because the allocations are, at least at the start, are going to be coming in more slowly.
Yeah, definitely it's a tough pill to swallow, I think, for a lot of us, knowing that there's only that small number, especially here at the beginning. I do want to get on to our viewer questions. We have one here from Crystal. She says that she's a new mom, currently breastfeeding a 4-month-old baby, and she wants to know if it will be safe for her to get the vaccine, and if so, will any of the vaccine pass through her milk to her baby to protect him? So Dr. Jones, I'll go back to you for this one.
It's certainly safe for a breastfeeding mother to receive the vaccine. I doubt that there's much protection that can be proven, and I'm certain it has not been proven yet. So again, Dr. Donepudi, do you have the answer to that question?
Well, I would say the one caveat is that they were not, breastfeeding moms and pregnant moms were not included in these early phase trials. So really, we just don't have an answer. Certainly, all due respect with Dr. Jones, I mean, I presume that it will be safe. Most vaccines are, especially when they're not a live vaccine, but we simply don't have a formal statement or formal data that has proven that at this point.
Yeah, and one thing that a lot of folks to keep in mind, this vaccine, of course, as we all know, very, very new, very recent, something we've all just, kind of had to wrap our minds around in the last 9 months. And so definitely something a lot more research and a lot more that has to be done with. But hey, it might be an answer and give us this hope that we need to finally get this COVID under control. One thing I did want to ask, when you touched on the clinical trials, Dr. Donepudi, was that no pregnant women and no women who are currently breastfeeding were included. There was no one under the age of 18 as well, isn't that correct?
That's correct. It's basically the guidance is for 16 and up for the vaccine at this point. Pediatric studies require a lot more rigor around basically just making sure that we're using good conscientious practices and enrolling participants in the study. So they were not part of these first phases of study.
And so right now, when we finally do get to that point where we're seeing more of these vaccines in Kansas, and we're able to give them to more people, it'll be anyone 16 and up who could receive one?
At this point, yes.
Okay.
I mean, I don't know, we may have more information by then, but at this point, that's the study data that we have to support.
Certainly good to know that one as well. Hey, and one last question before we take another quick break. Lori, she wants to know if an individual is currently ill with COVID, will the vaccine aid their recovery? So Dr. Donepudi, I'll go back to you for this one.
No. So yes, ultimately what Dr. Jones said, basically that immunity from a natural infection lasts about 90 days is the current estimate from CDC. After that time period, there may be benefit. We believe there would be benefit to getting the vaccine, but not in the immediate phase. And in fact, if you do have any side effect or reaction to the vaccine, that would just be an added misery to the infection that the person is already contending with.
I can assume so. So anyone out there thinking, hey, I'm going to go get this and I'm going to feel a lot better, not going to happen. Well, hey, okay, well, we're going to take another quick break, but don't go anywhere because we'll be answering a big question many of you have. What do you do if you're skeptical about this vaccine or someone else you know is? We'll get to that and more right after this break.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
We are back for our final segment in tonight's coronavirus special, getting your questions answered about the vaccine. And two of Topeka's Stormont Vail doctors are joining me tonight, Dr. Donepudi that you see here, and Dr. Clif Jones. And for our final segment, we're going to try and get in as many questions as we can. So let's just get right to it. Christina wants to know, after you receive the immunization, are you allowed to walk around without a mask, and how would you prove that you've actually received the vaccine? So Dr. Jones, I'll start with you on this one.
Well, I think you'll be provided some kind of vaccine certificate, which if you require proof, that would be of use. It'd be a part of your medical record. It probably would be stored electronically, but if you could carry something around with you, that might be of some value. But no, we are nowhere near the end of the need to keep our distance and protect people around us by wearing our face masks and asking them to wear face masks. The probability after vaccination is that you will have protection. The people that they were studying are people with normal immune systems and not an awful lot of underlying health problems. They did have a vigorous immune response and did exhibit protective immunity. But we're months and months and months away from the standpoint where healthcare providers setting an example to our patients and our families. Again, when the vast majority of the population won't have access for this vaccine for months, it's important to provide protection. So no, it's only a wishful thinking. It would be nice to imagine, but not yet.
Yeah, and just to be clear, so anyone who gets the vaccine, don't think that they're in the clear from the masks just yet.
No, that's correct.
CDC has also explicitly said we don't have data at this point based on the studies about transmission. So if you've been vaccinated, do you still have the potential to carry that virus to someone else? So based on that lack of information in that space at this point, that would be another reason for continuing those levels of protection.
Very good. Now, LUANN, she wants to know what will happen if someone receives the first dose of the Pfizer vaccine, but then the country or maybe even the state of Kansas runs out before the second vaccine can be given to said person. And Dr. Donepudi, I know you kind of touched on this earlier, but can you give me your take on this one?
Yeah, absolutely. Because of the way that the government is allocating the vaccine, they are holding back that second dose to make sure if you've started the series that you have that second dose available to you. So that should not be an issue.
Okay. And another question we have here from a viewer, they want to know, Anne asked, how long will this vaccine last? So Dr. Jones, can I get your take here?
It's unknown. We don't know. Again, hopefully it's a durable response. Again, the handy interval would be a year. If this is going to be like influenza immunization that gets repeated every year, influenza, the vaccine strains change annually, and it's not thought that the COVID-19 has that capacity, although we don't really know that either. But no, it's unknown how long the protection will last.
Still just kind of in that waiting period. Now, can you both just talk to me about what concerns both of you the most?
People not taking it. So people afraid or believing some of the propaganda or the conspiracy theories around the vaccine development, and allowing that hesitancy to stand in the way of them actually getting the vaccine. In order to really turn the tide for as a country and really as a planet globally, we really have to get to about 60% of us who are protected, who are immune, in order to be able to really start to have that herd immunity effect.
And Dr. Jones, I mean, is there one big thing that concerns you the most with all of this?
This is the most phenomenal and unexpected pandemic that I could have imagined. I mean, most of us were thinking along the lines of a new strain of influenza, at least where we would have some idea of how to manage it clinically going forward. The only thing that's going to slow this down is if there's a seasonal decline this spring and summer. Maybe there was last spring and summer, and maybe that's how we got through that period of time. That's a long way from now, and there's just no end in sight right now as far as the numbers of people, the percentages of people that we're testing that are testing positive, even people without symptoms that are testing positive. So we just know there's that large reservoir of infectivity in our community and communities where we would like to visit, or where we have people coming from those places to visit us. How is that going to change? And is there eventually going to be a tapering down? Maybe there is, but it's not in sight. So we need this vaccine. We need access to lots and lots of people. We need to get on top of it. We need to have confidence in the science.
And can both of you just, I mean, both of you are in the hospital. I know you've been around the people, you've seen, you know, your colleagues working with these critically ill patients, and we've seen so many people, our friends, our neighbors, our loved ones, pass away from this terrible virus. Can you talk to people maybe who are skeptical about this virus, but not only maybe still on the fringe, I should say, on whether or not they still believe that this virus might still be taking place?
So what we see, something we've never seen with influenza, we see a fourth to a third of our inpatient population are there because of COVID-19, and they're not in the hospital unless they're sick. So we do realize, we know people that have successfully managed this with minimal symptoms as an outpatient, even people that are older, even people with some health problems. So fortunately, 80% of people with symptoms have mild illness, but that 20%, from a healthcare provider's perspective, it can be overwhelming. And facing this as a gradually increasing problem, it's overwhelming. So it's real. I would say about half of our critical care patients are in critical care units because of COVID-19, and a substantial proportion of those individuals have respiratory failure as well as other organ system failure. It's a mess. So we know it's real. We deal with it daily.
32% of those that are hospitalized require ICU, and 15% die. We've had to deal with more death in a week than we've had ever. So our rates of mortality in the hospital are significantly higher, barring all other conditions from previous years.
If there's one thing I think people can take away from this tonight, is get this vaccine and take it seriously. Would that be something you both could agree with tonight?
Absolutely.
Yes, absolutely. Well, I want to thank you both so much for being here with us, taking time out of your schedule to come in and talk with us, answer these questions for our viewers. Remember to keep sending in your questions our way. We want to get them answered. Thanks for watching.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.